I was diagnosed in 2013 when I completed my undergrad degree. I did not make a first class and I did not quite deal with the disappointment very well. And I had a manic episode. But before then, I had manic episodes, but we did not quite identify it as bipolar disorder. But that was my fourth major manic episode, and subsequently, I was diagnosed.
Ghana is one of the countries to benefit from the WHO Director General's Special Initiative for Mental Health, which has an objective of, some more 100 million people having access to quality mental health across the globe. And then specifically for Ghana, the objective is for 5.2 more million people living in Ghana to have access to quality mental health care.
The World Health Organization is committed to supporting Ghana in its journey towards building a strong, resilient, and people-centered mental health system. Through the WHO Special Initiative for Mental Health, we have witnessed significant progress in expanding access to services, in strengthening governance, in building capacity of health workers, and in integrating mental health into primary health care.
Mental health, as far as in pregnant women and the postpartum period is concerned, is a significant concern. In fact, postpartum depression has been estimated variously to range from as high as almost 70% in some instances, and in some places about 30%.
For someone who might not necessarily have a mental health condition like I do, I know that sometimes there's pregnancy-induced psychosis, there's postpartum depression, or sometimes there are some other things like stress and anxiety that really affects mothers, and that could also affect the unborn child that needs to be caught as early as possible.
In the past, in our ANC book, we have a portion of where maternal mental health issue is. So we ask the client in a local dialect as Wajuma Kaunda. So because it's actually intimidating word, some will say no because they don't want to be seen or be tagged as a mental person. So they will just say no.
The policy certainly would contribute to capacity building because if you recall the situational analysis work we did, as high as 70% of healthcare workers say they are not familiar with the condition of maternal mental health disorders. They lack the skills to diagnose, or even if they diagnose or they screen positive, the ability to do interventions. And so that is a very big yawning gap.
We have over the years known through the data, and the data has spoken to us, that there was a huge gap between services within the rural setting and that of the urban setting. So the projects through this coordinating team were able to identify the areas and ensure that there was improved services, also the quality of service.
WHO came in to train us on maternal mental health, and actually it has really helped.
The development of the maternal mental health policy has been a very long process. We started by actually conducting a very comprehensive situational analysis. That was 2 years ago, to really give us a sense of maternal mental health services at the different levels of care.
Now with the policy in place, there's already begun some engagement because we made clear recommendations for academic training institutions. Because the Nursing and Midwifery Council, for instance, we've had a session disseminating the findings, and that we've been given some assurance that it will factor into their curriculum review so that at least maternal mental health gets to be taught during the pre-service training of nurses and midwives.
Early this year, I got an invitation to the launch of a maternal mental health policy by the Ghana Health Service together with the WHO. And I was quite surprised because for me, this is seeing something that I thought was a bit far to reach become reality. And I was filled with joy because throughout my antenatal, postnatal, there was no point where was I screened for any mental health condition. And if I wasn't privileged enough to have a psychiatrist who was also a friend, if I did not have a psychologist who was checking up on me, I don't know how things would have ended up for me. So I think that if this is institutionalized, now that the policy has been launched, if it's implemented, if it's institutionalized, it would really go a long way to improve the well-being of mothers.
For us in Parliament, we will play 2 significant roles, or maybe even a third. The first is that we will shepherd this policy, ensuring that there is proper oversight. So if the ministry has signed on to this policy, we want to see in their budgets. For several years, we hardly spend more than 3% of our annual budget on mental health. So we want to see deliberate effort in the budget towards the implementation of this policy.
These achievements demonstrate what can be achieved when governments, partners, communities, and people with lived experience work together towards a common vision.
I would love to thank WHO for the training. This is an opportunity given to me, and then I would love that they expand this program. It will not be just for a one-time thing. It will be expanded so that more midwives will be trained, so that it will help ease the work on the field.
WHO would like to express its sincere appreciation to the Government of Ghana, to the Mental Health Authority, to partners, health workers, communities, and all donors whose invaluable support has made this progress possible. Together, we can create a future where mental health is prioritized, is protected, and is accessible to all.